You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org.
AAPCHO's Primary Care Pipeline podcast series is a new segment highlighting careers in the Community Health Center network. Podcast interviewees discuss the advantages and rewards of working in community health centers, as well as the importance of ensuring that the community health center workforce as a whole remains viable. Dr. Thomas Tsang, formerly the Chief Medical Officer at Charles B. Wang Community Health Center in New York, is the Medical Director for Meaningful Use at the Office of the National Coordinator for Health Information Technology at Health and Human Services. In this episode, Dr. Tsang speaks with AAPCHO's Communications Assistant, Beverly Quintana, about the benefits of being a community health center physician.
Hi, I'm Thomas Tsang. I'm the Medical Director for Meaningful Use at the Office of the National Coordinator for Health Information Technology at Health and Human Services.
For the audience, Thomas was formerly the Chief Medical Officer at Charles B. Wang. Thomas, why did you choose a career at a community health center?
I guess I'm one of those fortunate few that got plugged into a community health center when I was very young. I applied for a career development programs that gave exposure to public health and healthcare as a career, and was sponsored by the old Chinatown Health Clinic, which is now known as the Charles B. Wang Community Health Center. And they were nice enough to bring a bunch of kids together and gave us a place to hang out and learn about public health.
Community health centers, how is it different from other primary care settings?
I think the community health center is just so unique in that it's a health home. And I think for Charles B. Wang, it was definitely enacted as a community center that really went above and beyond healthcare needs.
From a physician's point of view, do you have any benefits that you can share?
Well, the work that I'm doing right now, we know FQHCs are actually the leaders, early adopters of such technology. They have the systems in place that can assure what the rest of the country now is looking at, which is how do we deliver quality of care in a very efficient manner, and how do we do it that's patient-centered. For our community health center, we were able to incentivize providers to stay with us for a long time, and we have a very, very low attrition rate in terms of provider turnaround because we allow providers to create what I think as purely a clinical track or a clinical administrative track or a clinical research track or all the above, because we have a lot more flexibility. And on the financial side, our salaries are just as competitive as some of the private sectors. So I think there are a lot of benefits that are given to our providers.
Would you encourage medical students to consider a career in community health centers?
Well, definitely. I think as newer graduates come out, they should really look at what the community health center world can offer in terms of personal satisfaction, the flexibility to do this work that they want.
With those benefits that you mentioned, do you think it's still difficult for physicians to be recruited?
It is, because I think there's a lot of misconceptions out there. And so I think it would be helpful during medical school or during residency to actually rotate through the community health center. We have to take a look at the very, very broader context of medical training in the context of primary care versus specialties. And we would like the optimum number to be like 50%, 50-50, primary care versus specialty. So we need to create incentives that would attract people to go into primary care. And then from there, the more primary care doctors we have, then there are probably a higher probability that there would be a wider applicant pool to go into FQHCs.
Mm-hmm. You talked about the incentives that you offered at Charles B. Wang. Do you know of any other programs currently in place or that would serve as a good model?
Health centers are getting investments for health information technology and also creating different models of care like the medical home. So I think in that regard, community health center is a place where you can actually practice cutting-edge medicine.
Thank you, Thomas. Do you have any last words for either folks trying to recruit more physicians to the community health center world or new graduates that might be hearing this?
And I think community health centers are at a very, very good place to become leaders in this post-reform era. And so I think for the graduates out there who are interested in being part of this process, I think community health centers would be definitely a good place to look for a career. And I think for community health centers in general, if they just pay careful attention and being part of the process of change, I think they would be at a very good place to recruit some of the best graduates.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.apcho.org and tune in for our next podcast at www.aapcho.org.